Hi everyone, I'm Dr. Dushyanth Kalva. I'm a plastic and cosmetic surgeon working at Inform Clinics. Today, I'll be guiding you regarding who is an ideal candidate for a liposuction and who would benefit from a bariatric surgery. So, before we go into the differences between this group of patients, first let us find out what essentially is a liposuction and what comprises a bariatric surgery. In liposuction, what we essentially do is we target specific deposits of fat in a person's body. Say for example, somebody might be having a large tummy, too big for their personality, or somebody might be having too large thighs compared to the rest of their personality, or maybe it is the buttocks, or in some people it is the arms. But it is always a specific area that we target in this category of patients. Usually these patients might be in normal weight or slightly overweight, but these are patients who are willing to take care of themselves. That means take care of their diet, their lifestyle and their exercise, so that they at least maintain the results that is being provided with liposuction or improvise on it. So these are patients in whom essentially we are correcting body shapes. We are decreasing the contours of certain body parts so that they look in sync and in good shape. So that's what liposuction does. Now coming to bariatric surgery. What bariatric surgery does is cause weight loss. So there are many sub-varieties of bariatric surgeries like sleeve gastrectomy, Roux and Y, malabsorptive procedures, etc. etc. So but essentially what all these procedures are aimed at is to reduce your body weight. In these procedures there is no specific target of body shape or appearance or anything at all. It is just decrease of body weight. How the body weight occurs is really not in anybody's control. It is bariatric surgery is done and a person starts losing body weight. Say for example, a person can even go from 150 kilos to down to about 80 kilos as well. So this is a hardcore weight loss procedure with no choice of body shape whatsoever. So with this knowledge, I think it is already obvious that a liposuction patient is usually a normal to slightly overweight person actually wanting to change their body shape or change the dimensions of certain body parts like a tummy or a buttock or a thigh. So that is what an ideal liposuction patient should be looking at. So here weight is not as much a criteria as shape. That means since we remove fat physically during liposuction, some weight loss does tend to occur, but the actual goal is never body weight, it is the body shape. Whereas in a bariatric surgery patient, usually these patients are morbidly obese. That means their body mass index is 40 plus, or they have a 35 plus body mass index with comorbidities like uncontrolled hypertension, diabetes, or cardiac failure, and etc. etc. So these patients need bariatric surgery for them to lead a longer life. Otherwise, they end up in serious complications or even death. So here for these patients, bariatric surgery can be considered as a life-saving procedure, with the target being rapid weight loss so that they can come back to a normal health. So here liposuction patients are essentially already healthy, looking for an ideal body shape, so they can dress well, feel good about themselves, and so on and so forth. And a bariatric patient is trying to save his life by reducing body weight and decreasing the comorbidities. So these are the two very distinct kind of patients. The reason I am doing this video today is because in my clinic we get lot of overweight patients. Some are moderately overweight who would be suitable for liposuction, but some are actually suitable for a bariatric surgery. So if a person is better informed to take a correct decision, so they can get on, they can get to the correct treatment very fast. I hope it has been informative.